if there's anyone that has to think about trade-offs and optimizing and delivering actual product, it's someone who's running a healthcare system. So, Christine, over to you. How would you frame the day, and which of our 5 key points would you want to comment on?
Great. Thank you, Derek. Like my colleagues on this panel, the day has been both a bit overwhelming as well as rewarding. And given that I had the pleasure of serving on that NAM panel that came up with the report, Improving Diagnosis in Healthcare, this is particularly speaks to passions of mine. I'm also old enough and humble enough to say that some of my first work as a nurse who was moving into the quality improvement space was working with early surviving sepsis campaigns. And I grew up in Michigan, and I was naively convinced that we had it figured out, right? And that was, more double-digit years ago, let's just say. So after a really long trajectory and lots of opportunities in different academic and operational roles, the thing that strikes me about today that speaks to my heart is that for millions of lives to be saved, we have to start with things that are pragmatic. So my vision, we talked about the vision. I would love to imagine that 5 years from now, no rehab hospital in the country has patients with missing limbs because of sepsis. I would love to imagine that, 7 years from now, there's no clinician that I work with who overrode the sepsis alerts in the system because the patient didn't look sick, even though the data were telling a different story. More importantly, I'd really like to be in a health system where the culture was such that we could talk about these things, that clinician who is embarrassed and feels terrible because of what he or she thinks they missed, it has the courage and the support that Daniel said he would be looking for, and the message that Helen gave us this morning about disrupting the trajectory of disrespect is what she called it, that has kind of permeated at times the way we passionately work to get our work done. And probably most importantly, from where I sit, probably because, knock on wood, I've never been a patient, but I know the day will come, is that I think we do have to do the realignment, the total rethinking of what healthcare delivery is. And we really do need to look at that learning health system model. Patients need to be part of everything we do. So what does that look like at a health system level? I can imagine, and I use my hands a lot when I talk. Sorry. I tend to try and bucket things as I'm listening. So for today, I kind of clustered everything that I heard in the way of saying that if care is going to improve, we need to address within my health system and others 4 big areas. Context of care, and every health system is different. The technologies that we heard of, the research that we heard of that is so important, might have a great fit in some of our larger academic medical centers, but are not going to be particularly timely and relevant for some of our smaller community hospitals or ambulatory care clinics, where in fact the majority of care in the country is delivered. So context matters. Culture really matters. And I think we need to spend more time and space in healthcare systems on creating that culture of transparency and support that Helen Haskell talked about this morning. I think the notion that patients and families are at the center of what we do is critically important. The third C in my bucket of 4 C's that I came up with is really communication. And it's not only communication among providers and caregivers in a system and patients and families, it's communication among researchers with practitioners. It's communication among researchers and practitioners with administrators. We assume that they know the language and how important sepsis is and where it shows up and what they might be able to do about it, but we rarely have conversations about that. They can look at pay for performance and say our sepsis numbers are good or bad, but what happens when we look at our claims? What happens when we look at, okay, here's a case that was septic, but let's go through it. How did the clinicians feel? What did they see? What did they see as barriers? So some deep analyses of the cases that we have with administrators at the forefront so that they understand in this partnership with providers and patients and families what the opportunities are. And then the fourth C in my sort of clustering is cash or cost, right? And the reality is, we're living through COVID. I should have put a fifth C in there, right? Where's the money going to come from to do some of these things? And so thinking through this, I think this workshop sets a great platform to think deeply about really pragmatic steps forward. So in the last minute or so, in my initial comments, because I clearly could talk a long time about this, I think health systems really need to do a much better job of integrating patients and families and providers into our overarching structure. We need patients and families on key committees, on boards. We need medical staff providers and nurses on the board, on the decision-making bodies in terms of finance. And that tends to happen in some organizations much more dramatically than in others, or it might happen in terms of a committee that can refer to. We need to be in the same rooms. We need to be talking about it. We need to not be lost in the dollars and cents. We need to see the whole picture. I will leave you with a comment that I heard yesterday that I actually heard many years ago from someone, a patient who was not talking about sepsis, but a different disease, but this absolutely applies. And this person said, what I dream of is an interaction with a provider who wants to hear my story, not just my symptoms. And I think in that space between the story and the symptoms is the opportunity to figure out how to work more collaboratively and make our health systems improve and keep sepsis as a real priority. So lots to dig into here. I look forward to the discussion with members that it might have called in or other panelists because I think there's a lot to do, but I think the trick is we have to start. We can't walk away from this and say when the technology comes or when there is more money or when we know a little bit more about the science or when Kaiser tells us what they discovered so we can try to mimic it. Everyone needs to start because someone died today while we were doing this, many someones of sepsis. And we can't forget that. Thank you. I'll stop there for right now.